Hello, North Glen. I'm Mayor Meredith Leighty.
And I'm Heather Geyer, City Manager.
And good evening, Debbie Tuttle, Director of Economic Development for the city.
My name is Diana Wilson. I'm the call moderator. I'll just be doing technical stuff. For example, if you want to ask questions, you need to hit *3 to ask a question, and also keeping an eye on the questions to feed to our panel members. We're also expecting someone from the Health Department, Jennifer. Jennifer, are you on the line yet? Apparently not yet, but Mayor, I'll hand off to you.
Thank you. So thank you so much for joining us for our telephone town hall today. We're going to start out with an overview of how North Glen is responding to COVID-19. Then we will take your questions. We are following the State of Colorado Public Health Order. You may have seen or will see in coming days that the Tri-County Health Department has rescinded their order. That is only to avoid confusion by having multiple orders. Tri-County decided to rescind its order just so that everyone is clear that we are following the Colorado State stay-at-home order, which was issued by our governor. Right now, we have a few public health orders in place. The most recent is asking residents to stay at home. Please only go out for the absolute necessities: food, gas, medical needs, or picking up those necessities for remote work or school. For example, Adams 12 School District will go to remote learning on April 1st, but we know that some families will need to go to the schools to pick up some supplies, and that is okay. Another example is outside, walking outside and individual exercise outside. That is fine. We just need to keep away from each other to keep this virus from spreading. Gathering places and services that involve close personal contact are closed. No events, no sports, no restaurants or bars, though, thank goodness, we can still get takeout and delivery. For now, the stay-at-home order goes through April 11th.
Let me break in briefly. We know people are joining the call, so just to let you know, we're doing a brief introduction, and then once we have enough people on the line, we'll go to questions. City Manager?
Thank you. As far as city operations go, we have all of our buildings closed until further notice and following guidance from the state of Colorado. Our playgrounds are also now closed as a result of the governor's order. Parks and trails are open along with open spaces. However, residents are encouraged to practice social distancing. We're operating essential services like curbside trash and recycling, water, wastewater, necessary street repair, and police patrol. We have some limited services available by phone and email, building permits, paying for court fees and utilities, to just name a few. You can visit our website at www.northglen.org. We have several links off of our main page of our website that connect you with information on what essential services we're continuing to provide. Please know that many city employees are working behind the scenes remotely, and if we meet in a small group, we're using social distancing guidelines. We are still operating as much city business as possible without close personal contact and trying to set a good example for our community as a whole. We know business and work and school activity needs to continue, but we do have to do it in a way that keeps us from interacting with each other physically.
Before we jump into questions, I want everyone to know that we are working hard to keep North Glen safe, working hard to keep things going, and working hard to coordinate with others. If we are able to manage this now, then we will be able to move on sooner rather than later. Thank you all for your strong community spirit. I hear about all the kindness and support our residents and businesses extend, and it makes me so proud. We'll get through this together.
Thank you, Mayor. I know we have a lot of questions that are starting to come through the system. The mayor and I will have answers for city-level questions like police and trash and the recreation center. Hopefully we have our Tri-County Health Department representative, Jennifer Ludwig, on the phone. She's the Deputy Director for Tri-County Health. She's available until 6:30 to answer questions that are more health department related that we're not able to answer. So we're happy to take all of your questions, but for now, I'll turn it back to Diana to see if Jennifer's on the line.
All right, Jennifer's trying to get on right now. If you are listening and you have a question, please hit *3 on your phone. Of course, if you're doing the stream online, you could just type your question in there. We do have 2 online questions so far. One I'm going to hold off until we get our Tri-County Health Department representative on the line. But another one that we've recently had is, if I need to go pick up my kids and it's out of town and I'm driving away from my home, is that okay? Does that violate the stay-at-home order? City Manager, would you like to take that one?
Sure. Thank you, Diana. That does not violate the stay-at-home order. You do have the ability to take care of an essential functions such as going to pick up your children, taking them to appointments, going to the grocery store, etc. We are going to be posting the governor's public order on our city website, and certainly we can get into more specifics as we continue this conversation. But in terms of that question, you are able to go and pick up your children.
Another kind of related clarification is that you are able to drive and go take care of a loved one at another location.
Another question we recently had was, is it okay to go fishing here in North Glen? Mayor, what do you think about that one? They are by themselves in a park.
I think that's a really interesting question. I don't see anything that says you can't go fishing if you're doing it by yourself. The whole purpose is to stay in extremely small groups. Our parks are open for taking a walk. Our playgrounds are closed. The skate park is closed. And I believe the dog park is also closed.
And pavilions as well.
And pavilions, so picnic areas. So that's a great question.
So I'd say if you're fishing solo, that's probably the right way to approach
solo, you're probably fine.
All right, is that Jennifer? Are you on the line?
I am. I had the wrong pin. I was joining as a participant as opposed to a host. So thank you for your patience.
All right. Could you please introduce yourself?
Yes, Jennifer Ludwig. I'm the Deputy Director for Tri-County Health Department. I will say I am not a doctor and I'm not an attorney, but I will do my best to answer all of your questions that are related to the health department and the work that we're doing with the COVID-19 response. And I'll say the mayor did a fabulous job of introducing. I don't even think you need the health department.
I think we probably do. One of our first questions is, what is the infection rate for COVID-19?
It's a great question. It is hard to determine because we're not able to do a lot of testing. We are testing those who meet certain criteria. And give me just a second, I'll pull up. I can tell you the state numbers. The best barometer that we have is the number of people who have been tested and the number of cases that we have. But a lot of people, as we know, may have symptoms that might resemble it, might be flu. Only those that get tested and we know about can we really tell. But in the state of Colorado right now, we have, as of, I believe these numbers are from yesterday, 1,086 positive cases. There have been over 8,000 people tested. So we know that there's a lot more infection out there, but right now we're still in a lot of data collection phases.
Okay, that question was from Doug and Janet. Hopefully you heard the answer. We're going to go to the phones now. Michael, I hope you're ready. Looks like you have a good question for our mayor and city manager.
Hello, this is Michael and Virginia Aguilar. We live at Pinnacle Creek right here on Huron, where the trail crosses over. Anyway, this trail here, the Highline Trail, it's not very good for social distancing. There's a lot of people using it at this point. Older people, middle-aged people, younger people, kids. It's crowded like crazy, and if we're ever going to get on top of this thing and flatten this curve, this trail is not going to do it. I mean, what we're dealing with is airborne, and we're too close to each other to walk up and down these trails here. Is there any way we could possibly see about getting traffic on these trails either curtailed or limited at this point, just temporarily while this crisis is ongoing?
City Manager, would you like to take that?
Thank you. This is a really great question, and I appreciate you bringing it to our attention. I will commit to having staff in Parks and Rec go out tomorrow and take a look at the trail and see what we can do in terms of temporarily closing that connection, and hope that we can still provide good connectivity for others that may be using the trail to get to and from work or other places that they need to go. So we'll definitely look into that for you.
Please, and thank you.
You're welcome.
All right, so here's a question for our Tri-County Health Department person from Sabar. I hope you are ready to go live, Sabar. Oh. User error, 1 second. Sabar, are you on the line?
Yeah.
Would you please ask your question? I think it's probably most appropriate for our health department person.
Okay. My question is, thank you for your information. My question is that my son have almost 2 weeks coughing, fever, dry coughing, and he's day by day is getting worse. And he need to test for corona because he's living with a 5-member other family. If the other will contaminate with that one, and if he is corona, he should be completely removed from this house, should take care of somewhere, should not other person should take the virus. That's my question. He needs as soon as to be tested. I need to know how we should do that.
Absolutely. Well, thank you for the question, and I agree. Our recommendations for anyone who has symptoms and is not feeling well, especially if symptoms of cough and fever, shortness of breath, all of those signs and symptoms of coronavirus, you do want to be tested. I would recommend calling your healthcare provider, letting them know what the symptoms are, how long that they have been going on, and the concerns. Only a healthcare provider can give you the order to have a test. Some healthcare providers have test kits and they can do the test, or they may refer you to a testing site, and those change rapidly. There are some private labs that are testing. The state health department is no longer doing their drive-up mobile lab, but there are testing sites around the county, and some offices and even places like Stride are able, if they have the capability, to do the test. But right now you still need a doctor's order, so I would recommend calling your healthcare provider and talking to your healthcare provider about your concerns and the signs and symptoms, and ask to get an order for a test. And if the test comes back positive, absolutely, you want the family to stay in isolation. And the health department, if a test is confirmed, the health department would be reaching out and providing further guidance.
To be honest, he called almost 5 days ago for health care for the doctor. The doctor told him to stay home, but it's not getting better. And I told them go and again call them. They called them. They never accept that one. I don't know what I should do that. And he is backup. He's not calling anymore for the doctors.
Well,
we have your contact. Sorry, Jennifer. I was going to say we have your contact information. So why don't we look into that? Try and find you some resources, and we can give you a call back personally.
This is Debbie from Economic Development, and we got an email today from Advanced Urgent Care, and they are doing testing in the Brighton facility, not the North Glen one, but in the Brighton facility. So that is a testing location that's called Advanced Urgent Care.
Brighton facility?
That would be a license.
I believe it is.
Yes, that would be.
Brighton
Jennifer, do you have
facility?
anything you want to add?
No, I appreciate you sharing that resource. I think that's a great resource to provide, and more than just the testing too.
So Barb, we'll have somebody call you directly, provide you with that information, and just follow up, okay?
Thank you. I'm waiting for you guys urgently. Thank you very much for your information. I'm waiting for you. Okay.
Okay. Thanks. All right. Next up, we have somebody with a question about trash. That would be Brittany. Brittany, hopefully you're ready for your question. That'll probably go to Heather, our city manager.
Hello?
Hi, Brittany. Are you there?
Hi, I'm here.
Why don't you ask your question? Yes.
Obviously, this is a time for us all to be home, but let's take advantage of it being spring and spring cleaning and pruning and all those things. As we're home for these next couple weeks, tree trimming, bushes, I'm excited to at least give myself a peace of mind here at the house. How would you guys feel about like a double trash pickup? Kind of give us some clarity in these times, making us feel confident in our yards, our everything, house cleaning, everything. I feel like trash is very full these days.
So, Brittany, this is Meredith. I'm going to let Heather answer this question, but I just wanted to tell you that I completely agree because I have an extra cart and it's full already, and I'm doing exactly what you're talking about. We're spring cleaning, we're working in the yard, and I hear what you're saying.
Yeah.
Thank you for the question. It's good to hear this feedback, and we have been continuing with our regular trash pickup. I will talk with staff tomorrow about looking at ways to increase frequency of trash pickup if we can start doing a couple pickups a week. I do know that for yard waste mulching, we do have the first Saturday of the month starting on May 2nd. We're working towards that date. Go ahead.
May 2nd seems so far away.
It does. And so, that was the plan based on, every minute, hour, each day, this situation's evolving. So I will also talk with staff and see if we can't do something different there to open up some opportunities for residents to bring yard mulch over to our M&O facility. We're trying to honor social distancing,
right,
also to protect staff. But we'll take a second look at that, and then what we'll do is we'll push.
I'm so sorry, but even though to consider, the extra spring cleaning of your homes, I feel like since we're so at home, I feel like, just little things have kicked up. It feels good to be like, hey, this is the time to do those little projects you haven't done and this and that. So even just normal trash would be nice. Even every other 4 to 5 days, that would be awesome.
Okay, we'll take a look at it, and then any changes that we make, we'll push out on our social media channels, on our city website. So I appreciate you bringing that to my attention.
All right.
Thanks so much for calling. We're going to jump to some health questions before our health department person has to get off the line. So, Juanita Taylor, we're going to your question. Maybe.
Hello.
Hi, Juanita. Are you there?
Yes. Can you hear me?
Yes.
My husband have a kidney that they're watching, and they want to draw his blood on Monday. And I hesitate to give them that. I've canceled one appointment. Is there? Should I be concerned about going places where they take the blood? He's a patient of Western Neurology in Westminster, and we live in North Glen.
Are you concerned about him possibly being exposed to other people? Is that your concern?
I don't know what my concern is. This is kind of scary. The fact that there's been an invasion and then there's blood work as a part of the transaction here. I'm just wondering, am I questioning the sterility of the facility, or am I just afraid, or do I feel that until his kidneys get to the point that's probably be too late and then be sorry? I don't know what to do at this point.
I think that is a critical health appointment that needs to be kept, and healthcare facilities are really ramping up their cleaning and their procedures and making available masks for other patients and other people in the waiting rooms. With such a needed health appointment, I would recommend that you keep that appointment. You can call your healthcare provider prior to going in to share your concerns and make sure that everything is safe and that they're taking the right precautions for that. But that's very important for him to upkeep with his appointments.
Okay, I appreciate it. Thank you very much. At least it makes me more comfortable over the weekend.
Yes. You take care.
Thank you so much.
Jennifer, before you get off the line, we do have a couple of web questions that I would like to ask you. The first question was, if I get a test, how long does it take to get results? So that's one of the online questions. If I go get a coronavirus test, how long does it take to get results?
It's a great question, and it depends on where you get the test and what type of test they do. It can be anywhere from 24 hours to up to 4 days. So it just depends on who is doing the test and where, how they do the test. If you do go in for testing, you absolutely ask that question. When can you expect to get those results, and how will those results be shared with you? But it does vary depending on whether it's a lab that they ship to another state and have to wait, or if they do it right there on site.
Another question is, what if I don't have a healthcare provider? Are there some resources on your website if somebody does not have a healthcare provider?
It is a great question and definitely a concern of ours. There are facilities that could provide that if you don't have either a healthcare provider or health insurance. And the best place right now to get connected, 211, which is supported through the United Way, has been activated to help assist individuals to services. So, because who's testing and who's providing services changes frequently, the best number right now to call to find out where you can go for either healthcare or for a test would be 211, and they can connect you. They specifically for your community, but they're statewide. So it's a great resource, and they've just been activated today for COVID response.
And we have another question that's actually been asked by several people, which is, how many cases are there in North Glen? And another person asked where in North Glen those cases are. So how many cases in North Glen and where in North Glen, although I don't think we could answer that one.
Correct. I would not be able to tell you where in North Glen. I can share with you that there are 3 cases in North Glen, and that was as of this afternoon. Our numbers change dramatically from day to day. The numbers have really kind of stayed steady at 3 in North Glen. But just for perspective, in the 3 counties that Tri-County serves, which is Adams, Arapahoe, and Douglas counties, we have a total of 259 cases in the 3 counties. There are 60 cases in Adams County and 3 in North Glen. And those numbers, as I said, they change every day. We do keep our website post up to date, and we include the numbers per town. And our website, it's www.tchd.org. And there's a button at the top that you can click for COVID updates. and it'll give a daily recap of the cases by county and by city.
We also have a couple of questions asking about the people that have unfortunately succumbed to COVID-19. Is there any definite profile? Somebody was asking if knowing that information would be helpful.
Oh, that's a great question. And I would say no, that anybody can get it. It is a respiratory illness. What we see and where we have great concern is the older you get, the worse symptoms that you might have. Younger individuals may get it and it might be less severe, but we are also seeing a lot of young adults in the hospital from COVID, and so it is not anybody can get it. If you're young and healthy, you probably will recover sooner, and you may not end up in the hospital, although we are seeing a lot of folks that we were surprised at the younger ages being hospitalized. But our big concern is our older population, 65 and older, and the older you get, the higher chance of severe illness and worse, death. So that is why we are really, really careful in ensuring that our most vulnerable population, our seniors, are taking heed and making sure that they are staying home, doing what they need, and unfortunately in this time probably not spending as much time with maybe grandchildren as they would like to. But it is something that everybody needs to take seriously, because we are seeing this in all ages. With the exception of our children. We're not seeing a lot of cases in children and still trying to figure that out. But it is possible that children could be passing it to others, which is why we're concerned about large family gatherings. Even if the children look and feel healthy, we don't know if they may be carrying it and passing it on to grandparents or others. But that's why it's really important that we all do our part and take heed in these stay-at-home orders to protect ourselves and to protect our community around us.
So Jennifer, I know you're going to have to get off the phone pretty quickly. Is there anything else you'd like to share with us before you go?
Well, thank you. I appreciate the invitation, and I apologize. I was a few minutes into jumping into the line. I think you did a great job of introducing the stay-at-home orders. I just want to reiterate that Tri-County had issued orders. We rescinded those today and to enforce the statewide orders issued by the governor last night. And it's really important, and it's a scary thing to have these stay-at-home orders for the next 2 weeks. And people who have already been home might be going stir crazy, but it really is an important action that we can all take. And there's a lot of provisions. You can still go out to the parks, maintaining that social distancing, which if parks get crowded, I understand that can get difficult, but we want you to be active and exercise and be outside for your own physical health and mental health, but maintain that social distance. You can still go to the grocery store. You can go to healthcare. You can go to the pharmacy. You can go to the bank. There's a lot of things that you are still able to do, but they are limited and in the purpose to keep slowing this spread of this illness. So I just can't stress enough how important it is to adhere to the stay-at-home orders and really take care of your own health. Hand wash all the time, clean surfaces, keep surfaces clean, and maintain that 6-foot distance to avoid spread. So thank you very much. I really appreciate the opportunity to join you this evening. And if you have additional questions, please visit our website, tchd.org. We have a lot of information on there. And we also have a call center that you can call and ask questions. That number is 303-220-9200. Or the State Health Department also has a call center, and that is 303-389-1010. 1687. That is the co-help line, and they can answer other questions about either COVID, anything about COVID, or the state orders.
Thank you so much for joining us.
Thank you. Thank you very much. So really quickly, we have quite a few questions in the queue and a lot of really awesome comments coming through online. I wanted to really quickly, Michelle and Nancy, you have similar questions about grocery delivery. And so I have written down, this is Meredith, I've written down your contact information. I'm going to follow up with you specifically. I wanted to promote, we have a Facebook group called North Glen Cares, and it's a really specific group that you can join via Facebook. But what happens is there's a lot of volunteers that have said, how can I help? The purpose of the North Glen Cares group is to connect people who want to volunteer with people who have requests. And so, Michelle and Nancy, I don't want you to think that we're ignoring you. I'm just going to follow up with you personally when the call is over. Okay, thank you.
Now we're going to go to Lawrence. Lawrence, hopefully you're still on the line and ready with your question.
Yeah. Can you hear me?
Go ahead.
Yes. So by your numbers, you're showing a 13% infection rate, and I think New York is even 15%. With this low of I can't say low, with this infection rate, how long do we plan on doing this protocol?
So this is Meredith. Thank you, Lawrence, for asking the question. I think that's what everyone is wondering, to be honest. City Manager Geyer and myself have been on phone calls 3, 4, 5 times a day over the last week. This situation, as you mentioned, is ever changing. And so it's really hard to make a prediction like this. One thing I will say is we're not using the shelter in place language because that is an extreme kind of lockdown. The stay-at-home order that the governor issued right now has an end date of April 11th, but it also says that it may be extended. So I think what's going to happen is our health departments are going to continue to track the numbers, to take care of our residents and provide the health care, and it could change. I know I was on a call this afternoon with Tri-County Health, and one of their biggest topics for tomorrow morning's meeting is what do we do next? What's going to happen when this is over? And what does that plan look like? So it's a great question. We don't have an answer for you, unfortunately, and it is because things are changing so quickly.
Did that answer your question, Lawrence?
Yeah. I have a follow-up. Would those kind of discussions on when we do decide that kind of stuff, would we be trying to implement things like, I see a lot of stores doing where the elderly are able to go like earlier to the store or whatever, where we kind of, since that's the most endangered population, would we be kind of doing those kinds of plans past that?
That's a great question. I know we have a list of all of the different orders and all the different end dates. So, like for example, when you say would the restaurant or the grocery stores continue past April 11th their senior only hours, we would probably have to ask them. I think it's a great suggestion. But some of the public health order for restaurants and bars goes through the end of April. So that actually goes through April 30th. So there are different end dates for different orders. I think what you recommend is a great idea, and I know Debbie Tuttle, our Economic Development Director, is here, and so she can take that forward. Do you have any other ideas you'd like to add?
Not currently. I mean, I'm still researching on these, and I mean, in my honest opinion, I'm seeing research from Harvard and Stanford that are showing the mortality rates being comparable to the flu. So although I do take these with precautions, and I'll do whatever it takes to try to protect the elderly. I just don't. I'm not a fan of things getting too crazy.
Yeah, thank you for your feedback, and know that we, either a social media site or emailing myself or the city manager directly, any ideas you have, there is no one person that has all the answers, right? We have to come together collectively with all of our great ideas and see what we can do to support each other. So please know that if you think of something, let us know, and we'll do what we can to put it in place.
Thanks, Lawrence. I'm going to jump over to Randy asking a little bit about our grocery stores and ask Debbie to talk about our businesses and the kind of feedback she's been getting from them.
Sure. So specific to the grocery stores, they're all working very, very hard. And I've talked to all of the ones that are here in North Glen. So we have Walmart, we have Safeway, we have Natural Grocers, and Save-A-Lot.
So, Randy, can you ask your question?
Yeah, am I on?
Yes, you are.
Oh, okay. So my question was, when I went to Lowe's the other day, they weren't really concerned with wiping down all the cash registers. You know, everything's self-checkout now. And use the credit card machine, everything. And they weren't concerned with wiping that down, you know, between people. I asked the question, and she was like, they wipe things down pretty much twice a day or several. Who is watching that as far as at the grocery stores if they're keeping up with what they need to be doing, keeping people safe?
That's a really good question. I know I've been to the grocery stores and have seen them wiping the carts before everyone goes in. That's the right way to be doing it. If you have a concern, I would definitely talk to the individual stores to make sure that you feel safe. I know my father is elderly. He's 83, and he goes to the grocery store. And, you know, I tell him to make sure he wears gloves and make sure he takes the wipes with him so that he can protect himself. And I think that's a good idea for all of us. I know in my car, I do have gloves and I have wipes so that I can wipe off that door handle that I've touched or that cart that I've touched. So I think we have to take a proactive role individually. But if you have stores that aren't doing that, you definitely have a right to say that you're concerned by the way that the steps that they're taking to keep you safe. And if you have concerns, feel free to email us, and we can definitely talk to the individual stores. Good point.
Okay.
Thank you for calling in. We have an online question from Ricardo. Ricardo asks, how closely is the city working with our food vendors in regards to cleanliness? And where, making sure that there's no added danger. So, Debbie, who oversees restaurants and food establishments?
Well, Tri-County Health is definitely the people that do that, and the FDA. These our grocery stores as well as our restaurants take extra special care to make sure that all the food that they are providing to you is safe. Of course, this is a different time for all of us with COVID-19, so I can't tell you exactly everything that they're doing. However, they want to make sure that their employees are safe. So they're taking all aspects as well to make sure that they're keeping their employees safe, which of course is going to make their patrons or their customers safe. But that's a great question. I'd be more than happy to pursue that a little bit further. But, you know, a lot of times I know I've been watching the different restaurants and a lot of the news, and they say that the restaurants are cleaner than our own kitchens, because they need to be. So, again, there's no guarantee, but I definitely feel that same way. Even with the delivery services coming to your houses, they are saying to wipe off, anything that is coming into your house, just as an extra precaution.
I want to remind people on the phone, if you have a question, to please hit *3 on the phone. So *3 on the phone if you want to ask a question. We do have a number of web questions, but before I jump to those, just a reminder for those listening in, if you want to ask a question, please hit *3. Can I speak to something? Go ahead.
I see another trend in some of our web questions. Both Denise and Brandon are asking about volunteering, and I love that. I'm hoping that you can volunteer. So as I mentioned, that North Glen Cares Facebook group is the best place to go. However, if you reach out to us directly and let us know what you have time to offer, then we will connect you with our residents that have some concerns. But for Brandon, do we have enough volunteers? Right now, we do. The best way to volunteer is to check in with your neighbors. If you look, to the right 5 houses and to the left 5 houses, even if you just left them a little note with your number and said, hey, I'm here for you if you need anything, that is one of the best ways to make sure, because if every one of us on this call reached out to 10 neighbors, we'd be in really good shape. So, but if you want to volunteer, please reach out to us if you can't find a niche on your own. But thank you so much for elevating that concept.
And we have another web question that I'm going to hand off to City Manager Geyer about what you can flush.
Thank you, Diana. I'm getting a nudge from one of my wastewater crew members, Colin, so thanks for putting this comment on the platform. Just a friendly reminder that you only flush toilet paper down the toilet. Don't flush paper towel. The cleaning wipes are not flushable, even though sometimes there's some confusion in terms of marketing, and they say that you can flush them down the toilet. So we have a lot of great handouts, cheat sheets on our website and on social media platforms. Please only flush toilet paper down the toilet. Also, when you're putting things down the garbage disposal, please be mindful not to dump grease down the garbage disposal and other larger items that aren't meant for a garbage disposal. Please put those in the trash. Because our systems, our critical infrastructure systems such as water and wastewater, are experiencing heavier demands, we have already noticed that we've had to send crews out to particular lift stations and clear blockages and things of that nature as a result of that increased use. So please be kind and help us out with being mindful what you flush down your toilets and what you put down your sinks. Thanks.
All right. I think we'll jump to a phone question now with Brittany. Brittany, are you on the phone?
Yep, I'm here. Hello.
Please ask your question.
Sure. This is kind of just an expansion on a question that was asked earlier. I'm curious if we still have the capacity to schedule large item pickups on our normal trash days.
This is City Manager Geyer. Great question. Right now, we're not considering this an essential function given our staffing level. So I will talk with our Public Works Director tomorrow and see if this is something that we can add periodically, knowing that this situation has evolved over the last couple of weeks, and we've been very focused on making sure that our essential staff are focused on really essential services. So I hear your concern that you expressed earlier about more frequent trash pickup as well as a way to dispose of yard waste given the ability to be doing home improvement projects and everything. So we'll take a look at the big picture and then provide information if we're able to add that service back in. That is a normal service that we provide, and so when you see the April Connections newsletter come out to your mailbox here in the next couple days, you will note that right now roll-offs and special pickups aren't being scheduled because we have essential staff focused on other higher priority response.
Okay, makes sense. Thank you so much.
Thanks, Brittany. So we have an online question about people that might have an impact financially from this whole event, and we're going to go to Economic Development Director Debbie Tuttle to talk a little bit about resources if you are going to struggle to pay your bills because you aren't able to work because of this order.
That's a great question, and we're definitely getting asked that a lot with everybody losing their jobs or being furloughed. There is an executive order by the state for evictions, foreclosures, public utilities, disconnections. If you go to northglen.org, and you go to COVID-19 businesses. Now, this applies to residents as well, but that's where I know that order is at. There's a $3 million disaster emergency fund to provide short-term rental income households facing hardships, with a priority given to the ones that have been impacted by COVID-19. So the first thing I would say is first talk to your lender. Talk to your bank, talk to your mortgage company. They're really trying to work with you, and through this executive order, they're encouraging everybody to make sure that they look at all the help that they can give people for, again, deferring their payments without late fees, trying to work out a payment plan with you. So reach out, and that would be also for all of your credit card debts, any debts that you have. Please reach out to your debtors and please try to work something out. Again, if you look at that executive order, that is specifically around evictions, foreclosures, and trying to help people that could potentially lose their house. We don't want that to happen. If you do have any questions, feel free to reach out to me and I can provide some additional information for you.
Is that all are there links to those on our website?
Mm-hmm.
So www.northglenn.org. Go to our main website, click on resources for businesses. That also has information for people that need unemployment assistance and other resources.
Right, so go to the COVID-19 business resources. It's on the front page.
So that was for Jamie. We have another question about employees that are home sick. City Manager Geyer, could you talk a little bit about privacy laws for health things for people because we face that here at the city?
Certainly. Thanks, Diana. I won't speak specifically to privacy laws other than noting that HIPAA provides protection of medical information for our staff. What I can share with you is that we have the necessary policy in place at the City of North Glen, along with protocols that provide a safe and easy process for staff to follow if they do need to self-report that they're symptomatic, and then take the necessary steps to reach out to their healthcare provider and really not have to report to work so that they can focus on regaining their health to when they can come back and work with us at the City of North Glen. So we have been working with employees proactively in terms of communication. Employees are in constant communication with supervisors, managers, and directors. And overall, we have a very healthy workforce here at the City of North Glen, and that's why we're able to continue to provide many of the essential services that we're providing now. If worst case scenario, we see a huge increase and an impact to our staff and their overall health, then certainly I'll have to take steps to make changes to what services we can provide, and we'll communicate what those impacts might be with the community as a whole.
So for Jamie, who asked the web question, similar guidance is given to all employers that we're following here at the city. So hopefully, whoever you work with is following the same kind of guideline that people self-report, and anybody that may have been exposed will be contacted. We know the health department does that. When they find out somebody has tested positive, they backtrack and see who might have been exposed for exactly this reason. So there are a few checks and balances in place with your employers, with the health department, so people that are infected trying to find who they've been in contact with, so you would be notified. Mayor or City Manager, did you have another comment on that?
Well, I would just say, this is City Manager Geyer. In terms of City of North Glen as an employer, we discourage employees from coming to work sick. Again, going back to the communicable disease policy that we put in place several weeks ago in anticipation of the COVID-19, we have a very open environment to where employees know that they have job security and can take the necessary steps to make sure that they seek medical attention and don't come to work sick without any type of retaliatory behavior. I would say if you're an employee and you may be in a position where your work environment is not as I described here at the City of North Glen, then I'd recommend that you reach out to Tri-County Health Department and the state of Colorado. There's the COVID website along with a helpline that you can find information off of our website, and there are resources there so that you can access to help you navigate making sure that you don't need to go to your workplace if you're not feeling well and you're symptomatic.
All right, I think we're getting ready to wrap up our telephone town hall. Mayor, what would you like to share with citizens before we go?
One thing that's exciting is I've had about 10 people join our North Glen Cares Facebook group just in the last 10 minutes, so that's exciting. So thank you for that. And I just wanted to say thank you to all of the people. A quick little shout out to Lauren Weatherly. She's such an awesome resident, and I know she's worried about us and made some very nice comments about just, knowing that our city is working really hard. So I appreciate your participation. And, if there's some questions that we didn't get to, we still want you to ask them. As I mentioned to one of our previous callers, we also want your really good ideas. We're doing our best to follow the state order because that's our job. And so we are in compliance with that, but that doesn't mean that we can't get creative with some ideas that our residents have, because we are a tight community. And then I also want to just encourage you to join some of our North Glen Proud activities. If you have some white holiday lights, string them back up. We're using that symbol as a unifying and kind of act of solidarity. So if you have some white Christmas lights and you want to put those back up. And then we also have a North Glen Proud coloring sheet that you can find on our website or our social media. And you can color those and put them in your window or on your door, take pictures of it, put it on social media. We just want to maintain the great sense of community that we have in North Glen, and we want to keep that spirit up, even if we can't do it together and in person. So I wanted to just thank everyone for participating and just remind you that we are here for you. And I'll hand it over to Heather.
Thank you, Mayor Leighty. Thanks again for all of the great questions that were asked this evening. And as the mayor mentioned, we're accessible, so feel free to email me. My email is on the city website. If you did not have the opportunity to ask a question, feel free to reach out to us. We'll post all of the questions and answers on our webpage, www.northglen.org/virtual town hall. Also, a quick question for all of you, simply answer on your phone. If you found this helpful, when should we have another telephone town hall? A week? 2 weeks? Only if this goes on past mid-April. Please let us know your thoughts on whether or not you found this evening helpful, and we'll take that into consideration in planning for the next one.